Welcome back to the Arizona Daily Mix. I am here at HonorHealth in Dr. Rizik's office as we get ready for the live procedure, which is going to be a heart procedure right here on AZTV 7. We've been talking back and forth in my office, my studio, my, how can I say, sandbox where we like to play. Now we're in yours where you work, which is kind of interesting. Tell me a little about HonorHealth cardio area.
Well, first of all, we're excited to have you here. Everybody's been talking about this around HonorHealth. Brad Perry's coming to HonorHealth is what I keep hearing. This is a very unique place. It is where I work. We have an awful lot of fun doing the things we do. We love the things we do. We're very passionate about healthcare. We're very passionate about patient care. Well, first, we got you in scrubs. We've taken you into the lab so you can kind of look your way around. But what you're going to see, Brad, is really remarkable. You're going to be seeing patients at their most vulnerable. You're going to be seeing mostly elderly patients who are at the sickest, most vulnerable part of their life. And the things that we do, everything we do in there as a team is designed to return them to health, to return them to their life, and mostly to return them to their families. You know, this last year, there have been a lot of catastrophes surrounding this pandemic and patients dying of COVID. You're going to see a real ray of optimism here, a lot of hope, a lot of optimism around the therapies we provide patients.
Yeah, we've been talking over the weeks about this procedure and how literally, what we were saying, 10, 15 years ago, this wouldn't be possible, maybe even a little more.
Even a half a dozen years ago, many of the things that you're going to be a part of were not possible for these patients. We called them no-option patients because, as you and I have talked, they went to hospice or they went home just to die. Now, with this evolution or revolution in technology and innovation, we have therapies to provide patients who previously didn't have a treatment option.
Yeah. Okay. On March 9th is when it's going to be live. As he said, he's been taking me around here. But let's talk a little bit about what the audience and I am going to see, because I haven't seen anything yet. I'm a little nervous because, again, when we talk heart surgery, everyone's known where they cracked open the heart and all this. So this isn't going to be gory or anything.
Not at all. In fact, you're going to see very little blood. This is a minimally invasive technique. We use catheters. So you're not going to see a whole lot of blood. You're going to see a lot of imaging, advanced X-ray imaging, ultrasound imaging, even CAT scan or CT scan imaging. And what we have chosen, we've chosen a patient who has a diseased mitral valve. That's a one-way door between the upper chamber of the heart on the left and the lower chamber. And that valve leaks. And because that valve leaks, the patient's lungs are filling with fluid, a disorder we call heart failure. And we together are going to repair that valve without opening the chest through only a small opening in a vein in the leg.
All right. Let's talk to our viewers a little bit here about maybe not getting to this point in their life, even though they're going to be in good hands if they ever do get here. But, you know, we could prevent some of this, can't we?
We definitely can prevent that. So many of the patients on which we use this therapy are patients who have coronary disease. In other words, this is a downstream consequence of having coronary disease. And if you can live a healthy lifestyle, don't smoke, eat right, exercise regularly, and not develop coronary disease, you may not need to have this procedure we're going to perform. So many of the patients that we perform this procedure on do have coronary disease, however.
Okay, you have an amazing team that's going to be
Great
working with
team.
you. I
Great
got to
team.
meet them all, and I've actually been to one of them.
Right.
Who's been on our show. He actually did a little work on me. Not operating, but we went and worked out. He checked on my heart
Right.
and stuff. That's what I'm talking about. People don't. Okay, I'm okay. And so, but this is a great team, and I love how you were telling me as you were introducing me to everybody, and we were walking around, is that yes, you are the lead doctor, but you can't do it without a team.
It's a real team effort. You know, every football team needs a quarterback, needs a wide receiver who's a superstar, needs an offensive line, needs running backs, needs defensive backs, linebackers. This is a full team effort, and no one person can do it. And that's one of the things that it's important. I introduced you to our surgeon and our imaging expert and the other interventional cardiologist. None of us could do any of these things individually, but when we work as a team, there's no limit to what we can do for patients.
That's amazing. All right, so we are going to 8 a.m. right here on AZTV 7. It is called The Procedure, and it's live. I'm a little nervous, but I should be okay.
You're going to be great. You're going to be great.
And we want you to tune in because it's, again, not just a operation, you could say. It's a learning operation. You really have some stories you're going to tell people. You're going to show us the device that you use, which you rarely get to see. So we're literally taking everybody into an office that you don't really get to see that much.
And patients who watch this will have a better idea of what their treatment options are should they ever be confronted with coronary disease or valvular heart disease. So I think it's not just fun watching, but it's educational for our patients and for our community.
Perfect. And I do have to say it's going to be a very, not serious, but a very nice, comfortable place in there.
Yep.
But I was wondering, I do have the scrubs on. Could I maybe do...
Probably not. If you were a doctor, we say, see one, do one, then teach one. If you're Brad Perry, you're just going to talk about it.
Maybe I might be able to try. All right. We'll see. Dr. Rizik, thanks for having us
Thank
here.
you. So good to have you in our place now.
I love it. And don't forget, March 9th, 8 a.m. right here on AZTV 7. It is a live surgery with Dr. Rizik and his team called The Procedure.